I definitely didn't mean to move that forward, but that's okay. I can stay that way. All right, it kind of seems like our flow of entry is slowed in. Is Aiden coming tonight? Is she in here with us?
I don't think so.
Okay.
I don't see her. It's pretty late in Ontario, so.
It's very true. All right. Danielle's not saying anything, so I'm assuming that means she doesn't either. All right. All right. So it looks like we are ready to go. So welcome everyone to our GB Club Information Night. My name is Shalyn and I am your education chair for this year. So I will be leading some of this meeting tonight. Oh, it's moving forward. All right. Do we want to do a quick introduction of the execs that are here or no? Sure, go for it.
All right, I'll go first. Hi, everybody. I'm Nicole. I'm the communications chair this year, and I'm also acting as the volunteer engagement coordinator for Global Brigades for our campus.
I'll go next. My name is Sierra and I'm the medical president for the club this year.
My name is Sarah and I am the campus chairperson at UVic.
Hey, I'm Danielle. I'm the engineering co-president.
All right. And we have a couple other execs as well, but they aren't here tonight, so you'll meet them at our first meeting. So to start off, we're going to talk a little bit about what Global Brigades actually is. Global Brigades is the largest student-led nonprofit organization, and it was originally founded by students at Marquette University in 2003. Originally, it was designed to just be a Honduras medical relief trip, But when they found that just doing these medical relief trips were really unsustainable for those communities, and just helping provide medical care wasn't actually going to help solve their overall poverty and the health disparities. Today, volunteers from US, Canada, and Europe take place in programming in Honduras, Guatemala, Nicaragua, Panama, Ghana, and newly Greece. I don't know why this is doing this, but okay. So Global Brigades focuses on the idea of sustainable development. Just give me 1 second. The idea of sustainable development is our ability to giving a community its own ability to thrive without the need for foreign aid. And Global Brigade focuses on this full picture by trying to implement these 7 different chapters. So we see these as an overall span of the Global Brigade's organization. We at UVic don't necessarily have all of these chapters, but Global Brigades as a whole organization is comprised of these 7 chapters. So we have a business, a dental, engineering, human rights, medical, public health, and water. And the main focus of these is sustainable development through the implementation of the holistic model. And the holistic model is the idea brought into Global Brigades that creates fills in these different I don't know if you can see my cursor, but fills in these different categories. And so we start by bringing in a medical brigade that provides a sustainable health system, because realistically, you can't provide a sustainable community if everyone is sick all the time. So they start in and they bring in a medical brigade that gives people access to medical care that they might not regularly get access to. And we'll get into that a little bit more when we talk about our medical chapter. But once they meet these sustainable goals of meet a certain medical level, then we move on to water system. And I'm gonna step back for a second. So when we have our health system, the community, this gives our GB a point to see what the community actually needs. And so after they've gone through their medical thing, they're gonna look at the data that they've gotten back. And they're gonna see if we're seeing a lot of parasites from a lack of clean drinking water, then the next step would be to bring in something like a water brigade. Then that would bring in our engineering community, and they would design a clean water system for the community to have access to clean water. Another example of moving into our public health brigade would be something of, if we see in this medical brigade that a lot of people are having things like asthma and different respiratory issues, we might bring in a public health brigade to do things like bring in eco stoves, which is something they'll explain a little bit more, but essentially it gives them proper ventilation for their stoves so they're not constantly breathing in that smoke, which is going to make them obviously have these different respiratory issues. And after that, we're going to see these different communities are going to start to be able to not just survive on their own, but they're going to be reaching at this point where they're going to start to want to be able to thrive. And so at this point, then we're going to bring in our business brigades. And these are going to do things like we see here in setting up our community-owned banks and different economic developments. And so people are learning about different financial literacies. Again, we're going to get into a lot of the specifics of these different brigades in the next slide or two, but this is just an overview of how each brigade works within our holistic model. And so the very important part of Global Brigades is the access of partnership with our communities. And it gives these communities a sense of pride within their work, and which is going to overall encourage them to want to work towards keeping all of the work that we've helped bring them do over the span of the brigade. They're going to want to continue to do that if they're super excited about it. So having the community involved is a super huge part of what we do when we work on a brigade. And the end goal of a brigade is to no longer actually need brigades. We want to leave these communities in a sense where they feel like they're going to be able to thrive without needing these brigades to keep coming back in towards and working with them. All right, so Global Brigades at UVic. All right. So at UVic currently, we have a business chapter, a medical, dental, and an engineering chapter. And our business chapter was founded in 2018, and our engineering chapter is 2019. I don't know why I don't have our medical when our medical chapter was founded in there, but that's not information I know off the top of my head. All of our brigades participate in public health and water projects while they're on brigade. All right, and so this is our getting involved with UVic GB. Sierra, do you want to talk about the medical stuff?
Yes, I'd love to. Okay, so tonight I'm just gonna give you all sort of a brief overview of what an in-person brigade and telebrigade will look like medical-wise. But first I'm just gonna start with a quick refresher on what a medical brigade is. So global medical brigades are an international movement of students and medical professionals working alongside local communities and staff to implement sustainable health systems. The medical brigade part is, as Shal said, it's the first step of the holistic model. And it focuses on providing regular access to affordable healthcare services and medications, and also daily access to trained community health entrepreneurs who are always in the community. Recently, Global Brigades has had to make changes to the medical brigade structure to allow for it to actually be in person. So this slide here shows the revised plan for the medical clinic. Currently, volunteers are able to be part of the following stations. Consultation, this is where volunteers will shadow a licensed healthcare professional as they consult with patients. Gynecology, vision, charla, which is where volunteers will facilitate an education session for this year. It'll be for the adults of the community, and topics for the charla could include COVID-19, chronic illnesses, or mental health. Pharmacy, this is where volunteers will help gather medications and work with a licensed pharmacist, and also data informatics. Lastly, I'm just going to touch on the format of the medical telebrigade, which is what we actually opted to take part in last year, and we did this with Honduras. So global medical telebrigades are designed for aspiring healthcare professionals to build medical knowledge through skill-based volunteering, build cultural competency through virtual immersion, and deliver real impact through GB's local team by participating in live medical clinics. This innovative program incorporates mobile medical clinics, interviews with physicians, medical Spanish, an introduction to pharmacology, and exposure to unique epidemiologic case studies. In addition, the medical telebrigade offers an opportunity to learn more in-depth knowledge on the healthcare systems in Honduras, as well as some insight into the community selection, monitoring, and evaluation processes that Global Brigades uses. Next slide, please. So here's some of our medical brigade stats from UVic. On our 2020 in-person brigade to the community of El Tablon in Honduras, we saw 773 patients at the clinic. 669 of those were medical patients, and then 117 had dental treatments. And then we had 427 adults and 166 children attend the charla. And we also distributed 1,200 hygiene packs. And then in total for UVic Medical Brigade, we've been able to sponsor and provide over 7,700 patient consultations and 1,970 dental treatments. I think it's business now.
Yeah. So I'm going to talk quickly about our business brigades. So our business brigades include providing consultations to rural entrepreneurs, possibility of delight, I don't know how to pronounce that, consults to accompany the brigade, preparing resources to leave with your clients, leading interactive presentations to teach financial literacy, and working with community banks. So the idea with these brigades is that you're going into these communities and essentially helping them learn how to run their businesses and how to properly essentially learn these ideas like financial literacy and opening savings accounts and becoming comfortable running their businesses. So our first in-person brigade for GB Business did 5 business consults. And yeah, that's, I made that sound like I had a lot more to say with that than I did. There's our engineering. If Danielle, I don't know where Danielle went. There you
I'm here.
are. All right.
Hey everyone. So for the engineering brigade overview, so what we usually do on a actual brigade, we would go and visit the community on like the first day, and we'll access the current like water source. So like the community itself will find their own water source, and we'll go in there and we'll go on a not a quick hike, a little long hike, like maybe like a 1-2 hour hike up to wherever the water source is, and you'll look at their existing water source and like and the one that they're going to use like now as well. And then after we look at that, we usually go back and like eat lunch and stuff, and then after we would start mapping and surveying after like the second day for like 2 or 3 days, depending on how big the location is and depending on what area we get. And then after we do that, we'll start to design the project, and we'll use like apps, softwares like Google, Google Earth and MapSource and Epinet, which are all like super simple softwares, but they'll like teach you how to do all of that when you're on the brigade. And then after that, you present your design to the community members, and we usually present in Spanish. And the local engineering technician will also retranslate what we said if we're like not very good at Spanish. And after that, we follow up on past completed projects, and we also get to usually go on a water brigade and experience what that is about as well. Yeah. Next slide. We'll move on to the next slide. So our impact. So we went on our first brigade in 2020, and we were able to contribute 1 new water system design, and we were able to follow up with 1 community.
Okay. Hello, everyone. For anybody who missed my introduction, my name is Sarah, and I am the campus chairperson here at UVic, which means I am the connection between UVic's chapter of Global Brigades and the rest of the whole international organization. I'm sure that a lot of you, if not all of you, are here because you're interested in traveling on brigade this year, and whether or not that happens is going to be an extremely difficult decision to make. And I'd like to be completely transparent with club members while we make this decision. So I'm here to tell you everything we know at the moment. As we have learned, the COVID-19 pandemic is completely unpredictable, and the situation worldwide will likely change a lot by February. Cases are still rising in BC, and it's so hard to tell what's going to happen in the next 5 months or so. As for our partners in Honduras, where we would most likely be traveling, they're pretty far behind us with their vaccine rollout. And I don't know the exact case numbers today, but I know that their hospitals are also struggling with full capacity. But let's go to the next slide. So Global Brigades has been successfully running in-person brigades since June at other universities, with the added requirements shown on the screen here. All members need to be fully vaccinated. Personal protective equipment must be worn at all times, including at the compound and on the buses. And the medical volunteers on their brigade need to wear their full gown and everything. There is an additional donation goal for COVID insurance, and this cost in Honduras is about $160. So this is to cover anybody who gets sick on brigade and needs to be hospitalized or needs somewhere to quarantine. It also covers the test of your PPE and your COVID test in country. But with this in mind, there are still additional travel requirements that we have here in Canada that we are responsible for on our own. So for example, when we're leaving the country now, we need to get a PCR COVID test before we travel, which costs about $250, I think. And lastly, there is a maximum capacity of about 20 to 25 people for brigades at the moment. No, this does not mean that we will have to choose who is allowed to come on brigade, but it means that there's a chance we'd have to run like separate brigade groups, which is a lot less fun than sticking together. And then last thing, for any new members who might not know this already, the cost that we pay for a brigade is your flight plus your donation goal. And a donation goal is the cost that we pay to global brigades to support our projects, and it's a donation, so it's non-refundable, but this could be saved for a future brigade. This year we have been quoted a donation goal of about $1,300, but in the past this has been significantly reduced with fundraising participation. But my point I'm getting at there is if we kind of book flights and travel and pay $1,300 plus all of our other fees, then the trip gets canceled. That part is not exactly refundable unless you are looking to participate in a future brigade. The executive team and I will be having discussions over the next few weeks and plan to make a decision probably sometime in October. If UVic does decide on telebrigades, and if you're extra keen to participate in an in-person brigade, just know that there is the possibility of joining another school on their trip, but we will cross that road when we get there. I think we are almost at the end, but please stick around if you have any questions about GB's response to COVID, telebrigades, or anything else that you've heard today. And I hope to meet you all soon.
Hi, everybody. So for most of our communication between the executive team and our general members this year, we are going to be using the Instagram. So if you haven't already, please go follow us on Instagram. We'll also be trying to post on Facebook, but it's mostly going to be between Instagram and the emails that we sent out. So if you didn't get an email, I think at the beginning of this week, might have been the end of last week, make sure you go on our website and sign up for our email list. Other than that, Charlie, you want to go to the next slide? Yeah, so the voting for our meeting times will be ending tonight, and we will be deciding over the next few days which of our 4 meeting times we will be sticking with for the year. So if you haven't already, please go vote, and it's on this, you can use this QR code to see our link tree, and it's the first link on there. So please do that sometime tonight so that you can make sure you get, we have a meeting time that fits your schedule. And that's it. So if you guys have any questions, feel free to put them in the chat or unmute yourself and ask us. All right, so Sarah, you want to take it?
Sure. Yeah, we usually run the brigades over February reading break so that we don't have to miss much school. There's been, like, I think last year we had to miss 1 day of school, or not last year, but the pre-COVID year we had to miss 1 day of school, but most profs are pretty good if you have like midterms or anything that needs to be deferred, and we can get you a letter as well. We did the same for the telebrigades, for the medical telebrigade, but the engineering telebrigade ended up being spread out over a longer period of time. So they had it once a week for about 6 weeks, from May to June, I believe.
I can put the slide back up. Just give me a sec.
Are there any more questions? Yes, no, maybe. I see Allison's question here. It's, are the brigades limited by majors? No, you can be in any major and go on any brigade that you'd like. It doesn't discriminate, so.
And there are no prerequisites either. Like if you know nothing about medicine, we'll teach you how to take blood pressure, or you can just like skip that station if you don't feel comfortable with it. It's totally open to any and everybody.
Technically, blood pressure won't be an issue because we're not doing triage if it's in person, but yeah.
That kind of thing though.
So for the dental comment, that's very cool. You're a licensed dental assistant. Right now, they're not having any volunteers at like the dental station. Like they're not having any of us there just because of COVID. But that's very good to know. I think that, yeah, all the stations will eventually come back. It's just right now they're only limiting it to a few, but they do say that they are constantly monitoring the COVID situation. And, you know, by the time that we potentially go on brigade, there might be more available then. But yeah, probably like next year, I'm sure there'll be a ton more that we can do. But that's just the situation for right now.
And the stations do change a little bit, like because they offer that we can pay for add-ons. So in our tele brigade, we chose to add on a dermatology station, which was really cool. I think, was the gynecology an add-on as well?
No, I think gynecology was just one of them, but
there are like different things you can add on though to kind of change it up. Well, if that is all for questions, I think everybody's free to go. I'll just get the other execs to stay on for a couple minutes at the end.